Hi, everyone. Dr. Michael Miyazaki, and thank you for joining us. And we're really excited about our interview today. We have Tanya Dunlap, who is the Vice President of Clinical and Business Development over at PriorProtect. And we got some super exciting news today, and that's why both of us, Tanya and I, are both so excited. So, Tanya, thank you for joining us.
Thank you for having me. I always love talking to you.
Yeah, I always love talking to you, but I know we should have party favors.
We should.
We are getting together today to celebrate that this year is the 20th birthday of Protect, which is pretty amazing.
It is pretty amazing. When you start something brand new in the industry and you create this whole new sector in the dental marketplace and you reflect back and you think, wow, we have made a difference and it's exciting. And there's new innovations that we're going to talk about today. But, all the way back from when this company was founded to help patients, it's still all about helping patients.
Yeah, I know, definitely. And I think, 20 years, not only has a product improved over those 2 decades, but I think it's stood the test of time. And when you look at, well, being a product, let's look at sales. When you look at sales or the number of patients that were using this product 20 years ago versus today, I
Yeah.
mean, today it's, in the thousands every week. So it's really made this progress and it really is touching our patients. And myself as a clinician using the perio trays, it's really changed, I think, our practice. So no, thank you very much
Yeah.
for taking that leap.
Well, I'm so excited to be here. You talk about the all those cases that go out every day. We've got them now in this beautiful packaging. And if you're a PeriProtect provider and you're listening, the packaging is changing next month. It's even prettier. But when you go
Yeah.
into the lab and you see the rows and rows of all those cases being prepped to ship every day, it's beautiful. It's really exciting.
That's good. No, so now what I want to do is I want to take our listeners, our viewers back, kind of recounting how Prayer Protect came to be. And as I was mentioned before we started this recording, you probably have told this story tens of thousands of times. But I think it's really kind of what brings it back. What was the purpose of it? What was the human
Yeah.
side of it? It wasn't just, okay, we need to sell something, right? It was really trying to find a personal solution. I think this is a great story
Yeah.
to tell.
Yeah, that's right. It is such a good story and it's personal because I know all the people, so I can tell it with a different kind of color to it. But there was a general dentist. He was trained with periodontists, and he ended up doing general dentistry and focused on temporomandibular joint dysfunction, trying to find non-surgical options for patients with TMD. And this dentist is my father, so this is how I know this story. I lived this as a young person coming up in the world. And he was trying to solve problems that every dentist across the country is trying to solve. How do you treat periodontal infections, whether it's gingivitis or periodontitis, or whether it's around an implant or crown mark, whatever it is? How do you treat that between office visits? Because your toothbrush, rinse, and floss don't get deep enough. Your patients come in every time they're in there, they're chronically bleeding. It's placing a chronic burden on their immune system. And the patient that really challenged him was his mother. And she came in and she, as the disease progresses, you get to the point where you need surgery. And she needed surgery. And so he sends her out for the quad of surgery and she comes back and he's like, Mom, this looks so much better. This is great. We're ready for the next one. She says, Oh, no, we're not ready. I'm not going to do it. This was before lasers, before you had any other options, right? She said,
Mm.
Look, I've got food trapped in there. It's really sensitive to cold. I'm not going to do it. I'll do anything else that you want to try, but I am not going back for that. And so he tried what we all know to be effective. When you have a bacterial based infection, you prescribe antibiotics, right? Don't you? This is
Yeah.
what we all know from the 20th century. And antibiotics can have a positive benefit, but as soon as they wear off, typically your infection returns. And he was trying to apply local antibiotics also. So he tried, just a syringe that you put in there and they flow all back out. He tried a variety of trays and they leaked. And he had this one system that had so much promise. It was tufted floss. And every few inches, you'd have this tuft on the floss, and it soaked in tetracycline, and the patients would floss very diligently and they would come back and some of them had really good results. Sent it to controlled clinical trials. It totally fell flat. It was technique sensitive. It just was not effective over time, right? So you can
Mhm.
imagine a tetracycline might have some effect right away, but then you also have bacteria that build up resistances to it. You have all the problems.
Mhm.
So he went back to the drawing board and he finally came up with a solution that was easy and comfortable. And it was this tray. It was super comfortable and flexible. And he designed it. It's customized for every patient, as you know. It has an internal peripheral seal. And the internal peripheral seal and the extension beyond it works like a gasket and it prevents the medication from leaking out. This medication gets really, really deep and holds it there long enough to be effective. Now, in the beginning, he was still thinking antibiotics. And so he had a liquid tetracycline and he put inside the tray with the tetracycline hydrogen peroxide gel. The gel was supposed to make it gooey and it was supposed to be a propulsion agent to make sure that it could get really deep into the pocket. And that was going along just fine. Patients were getting really, really good results, and their teeth were getting whiter, and their breath was getting fresher, and everybody was happy about those side effects. And one day, a patient comes in. This is the way science sometimes happens. Patient comes in, and dad says, "Okay, you look great. Keep it up." And she says, "Do I still need to use that liquid?" Which is, of course, the antibiotic. And he said, "How long have you not had it?" And she said, "Oh, I haven't had that for months." And then he realized, oh, the antibiotic is not where it's at. It was the hydrogen peroxide that was doing all the work. And so
Mhm.
then he went back to the literature and he found Bill Costerton, who was doing all this really interesting interdisciplinary work. And Bill had gotten involved in dentistry also. And so Bill Costerton became a good family friend. And they worked hard together to help explain this and do some early experiments that showed huge reductions in bacterial loads. And then it went to controlled clinical trials. And that's where I step in. I was the research liaison for a long time. And so if anybody's interested in that research, I would love to talk to you about it. I spent like 4 years of my life on it. And I am really proud to say that ParaProtect is still the only company with FDA clearance for this. We had to get FDA clearance to take it to market for deep delivery because it was a brand new product. It's the only company that has research behind it that allow you to make claims with any kind of predictability. And it's also the only tray that's made out there that really precisely fits the two CDT codes for upper and lower. So now, after all these years, we know also how effective ParaProtect is for implant maintenance, which is a huge concern in the industry. And we also have some new products. And that is where our relationship has developed, Dr. Mike,
Mhm.
with this company that is developing new products to give even better solutions for patient health.
No, it's great. That's a great story. And like I said, I mean, it was kind of born of necessity, but it's
That's
really
right.
helped a lot of people, tens of thousands of people. So that's great. Thanks for sharing that.
Yeah, we've had like we're getting close to 1 million at this point, which is really exciting.
Oh, really? Wow.
Yeah,
Yeah, that's a pretty big number.
yeah.
So whoever gets the millionth tray fabricated gets a prize, I guess, huh?
Again, we got to figure that part out, right?
Yeah. Well, so tell me now, what does it mean again to have made it to the 20th? So real quick, my son, just last week, we celebrated his 20th birthday.
Yeah,
So,
right.
you're happy, you're proud, and I'm sure you, your family, and the whole Paraprotect team feels somewhat similar.
We do, but just like your son, when you're 20, you're looking forward always,
Hmm.
right? Like what is next? Like you've gotten through high school, you're in college, you're trying to wrap that up. It's such an exciting time in your life.
Hmm.
And I would say it's super exciting here for us also. We're expanding. We've got new teams, new fabrication methods. Just think about all the changes in dentistry, right? We are almost 100%. I mean, the lab itself is 100% digital. Like if
Yeah,
you send in an impression, we send it through a CT scan. We digitize everything.
yeah,
But about 85% of customers are sending digital scans now. So all that has changed. And there's just so many new things to look forward to also, and so much more that we can do to not just it is important and it's the most important thing to improve patient health but to make clinicians' lives easier and better too.
yeah. No, I think Paraprotect is really streamlined system. When you look at it, if you go back even a year and a half ago, you would talk to the patient, say, "Oh, you got these bloody gums. Here's an alternative. We could do the perio trays for you." And you would take your impressions and they're gooey and everything like that. You'd have to have the patient tolerate that. Then we'd send all that gooey stuff over to have the trays fabricated, and it would take weeks to get it back. And
Yeah.
so, 3 weeks later, we get the patient back in. They've forgotten how bad their gums were, the story we told them 3 weeks ago. And they're not looking forward to coming back because they think we're going to put the gooey stuff. But we go, no, no worries. We just have the trays to give you today. And so we give them the trays. And it was just kind of a long, arduous, drawn out process. Whereas today, like you were mentioning, because everything is digital, what we do is we just scan our patients, send those digital files to Protect, and you fabricate the trays usually within days, and we get that everything back within usually about a
Within
week. Yeah.
it's usually 4 to 5 days, depending on
Yeah.
you're in California, so it might take a little bit longer, but we use FedEx 2 day, so it should get
Yeah.
to you very quickly. It should be a 4 to 5 day turnaround, and patients are ready to go immediately.
Yep. So if any of you
And the
that,
scans are also usually more accurate, right? So
yeah.
you've got a better comfort fit and
Yeah.
all those. Yeah,
Yeah, you don't have to deal with all the pulls where your impression
that's
didn't
right. Yeah,
get that gingival
yeah,
margin. Yeah, no. So if you have used these trays in the past and maybe you weren't thrilled by that wait time or this the process, now it's gotten so much easier. You just tell the patient in hygiene,
yeah,
hey, this is what we recommend because your gums aren't getting any better. And then while the patient's there, we just scan the mouth and it just takes
right.
minutes, no gooey stuff.
That's right.
And we get the trays. So no,
And it's a beautiful package when it comes to you. It comes with 3 tubes of gel. You don't have to stock the gel in your practice anymore if you don't want to. If you can, totally do that and give patients refill, but you'll never run out because you
no,
always get 3 tubes of gel. It's beautiful packaging. We want people to walk out of your practice feeling really confident in your services.
yeah, no. So you guys, well, Protect has become a beautiful product over the last 2 decades. Like you said, it keeps
Thank
getting
you.
better. So let's go into what we're both so excited about because what we do is we identify usually biofilm that's causing the periodontal issues or the implantitis, implant mucositis. And so now apply the trays and we get that better health because we get rid of the biofilm. But the other bad thing that biofilm causes in our mouth is demineralization of the teeth or, out and out decay
Yeah.
interproximally. So I'll let you do the announcement, but we have a new product that is now being paired up with the Perio trays for better delivery, and I'll let you launch it off.
Well, thank you. Even though you tested it in your practice, we want to
Yeah.
hear about your own patients. But we are calling this ReminGel. It is an aqueous, non-fluoridated, no xylitol, hydroxyapatite rich gel that you apply in a perioprotect tray, just like you do the regular gel that your patients know. And then they wear the tray for 15 minutes. That's it. And this differs significantly from other remineralizing topical agents that people are used to. So, both in the delivery, because the tray has sustained contact with high concentration, and then also in the gel itself, it flows beautifully in that tray. But the gel has hydroxyapatite in it, but it also has other ingredients in it that make it really, really successful. It has precursor compounds to hydroxyapatite, and it also has bioactive calcium and phosphate and potassium ions. So we're positioning this system for patients who are high caries risk, like they might have white spot lesions, like the patient in your office. The patients who have xerostomia, whether they're medication induced or they're radiation induced or some other source, and of course patients with chronic sensitivity, which is really where this is shining. And I was surprised. I had no idea how many patients are out there with chronic sensitivity. There really are a lot of people who are looking for this solution.
Mhm. No, you're absolutely right. I mean, I think the sensitivity comes from people grinding their teeth more. People are more aware of airway issues, so they're breathing through the mouth more, and that
Okay,
causes
yes.
more issues with the oral cavity.
Yeah,
And people are taking more medications. It seems like everybody has high blood pressure these days. I don't know
that's
why.
right.
And so, all these things add up to people having dry mouths. I think the dry mouth leads to possibly more decay, at least more sensitivity,
Yeah,
demineralization of the teeth.
yeah,
And having something like this, and yeah, again, being in California, a lot of our patients will ask, well, in the past, we've used fluorides, fluoride varnishes, we've used the prescription strength fluoride toothpaste.
right.
And patients today, when we recommend the use of fluoride, they'll say, well, is there any other alternative to fluoride?
Yeah,
And we know there's a lot of information out there that kind of scares some of the patients or concerns the patients about the use of fluoride. And so today we have been able to offer our patients this Remin gel from Vista. And again, what it will do, as Tanya's saying, is it will help to remineralize areas that are uh, demineralized, white spot lesions, even areas of early decay. And we are tracking these lesions, even the interproximal ones now, to see how they heal up, because we think
that's
that
right.
it should heal up. So we've got photos. We're not going to show the photos again during this session. We want to just kind of talk about Prayer Protect and the 20th birthday, and then introduce ReminGel. But this coming Thursday, just 3 days from now, we're going to do a full out recording where we'll have all
That's right.
the research, the slides, before and after photos, and that will be recorded. So if you listen to this and you're trying to figure out, okay, where do I learn more? In 3 days, we'll have another recording out, and that will kind of have all the graphics and everything like that that
Yeah,
make this so
that's right.
exciting.
I think it's also important to consider all those things you said, but our nutrition matters to the
Mm,
health of our teeth, right? So if you're like me, you drink a lot of coffee, or you drink I drink a lot of flavored waters that are
mhm,
carbonated, that are super low pH. You get that acidic challenge, and then your teeth are also demineralizing. And if you don't have healthy saliva, let's say you're a diabetic, right? You have low
mhm,
saliva or poor quality saliva. For all of those reasons, you may have xerostomia also. It can really be helpful to have this remineralizing product every day.
mhm,
So it's so unique, though. I've really had a chance to dig into some of the science and the precursor compounds. So what the engineers have done is, I think, pretty important. So
mhm,
they have a manufacturing process which they refer to as wet precipitation. But you are taking base chemicals that you just buy here in the United States, and through this manufacturing process, they're able to create hydroxyapatite suspended in this gel, hydroxyapatite precursor compounds, monatite and brushite, which like bind to the tooth surface faster so you can build on it. And then also the free floating bioactive ions that will naturally be attracted to the demineralized tooth surfaces that has positive and negative charges. And then, of course, those ions are tiny, right? So everybody wants to know, how does this product compare to nano hydroxyapatite? Well, it's almost impossible to do a direct comparison because of the differences in the two gels. But those ions that are tiny, especially the potassium ion, can get very deep into the dentin tubules, occlude them, and then you get hydroxyapatite forming over it. And so, those early studies, the people who were in the beta tests that are now like 9 months in, their testimonies are pretty powerful. That they
mhm.
weren't able to drink even water out of a faucet. Now they're eating ice cream. That's a good quality of life improvement.
Yeah, it's one of those. So some of the case studies that we've seen, and the photos will show some of the photos on the web recording we're going to do in a few days. But we had a patient that came in, and Dr. Peterson, who works in our office, was taking photos. And this was a patient that had white spot lesions along the gum line. And even in between the teeth, there are some early kind of cavitation type lesions going on. And our patient was using, so we should go back to the protocol. Again, as you mentioned, this is a gel that remineralizes the teeth. But if you just brush it on, we're not quite sure,
Right.
it's a game of contact time. So if you put it on the tooth and it just gets washed away 10 seconds later, it's probably not doing that much. But if we put it in the tray, and now the tray is holding up against the teeth, and
And delivering it deep against a root surface,
yeah,
right?
yep, yep,
Yeah,
yep. So if you combine that, and now the patient's wearing that for 10 to 15 minutes, just like they would the perigel, then we're seeing, dramatic improvement. So tracking those white spot lesions over time, we can see that they're becoming less shiny. The
right,
white color's going away.
right.
And what a white spot lesion when it's dry looks really frosty because it's lost that demineralization. And over time, they're actually starting to turn shiny again. So
Yeah,
it's doing a pretty amazing job. And then we've had patients using it for sensitivity. And I had a patient, it was a lower right tooth. I think it was tooth number 30, which would be the 4-6 in the international numbering system. And the patient was just convinced this tooth needed either a filling, crown, or even a root canal because the pain was just so bad.
Yeah.
It's just so sharp. And so and this patient had been using another prescription fluoride type of toothpaste, applying it there. And so it was just getting worse and worse. And so we thought for sure it's going to need a root canal. But we said before we do the root canal, the patient had paratrays. Let's go ahead and use the ReminGel on the paratrays. So the patient used it one night, and if you looked at the scale where, let's say, 100% of this intense pain, where eating anything, breathing anything, just really
Yeah.
hurt. Just in one night, the patient's words were that it went from like 100 down to maybe 5. So
Yeah. That's
like,
exciting, isn't
and
it? Yeah.
yeah, and then I said, well, use it another day. And it went from like that 5 down to 0, 1, where it really wasn't even an issue after that. So it really amazed the patient. But that was just after, 2 days of use. And when you start to see the research that will show in a few days how dramatically the sensitivity went down because you've got the
Right.
potassium and the occlusion of the tubules all going on at the same time, how effective
Right.
that is. So that's why we're so excited about this.
It is. And it's exciting because if you think, I was not paying attention necessarily to hydroxyapatite will bind best to a tooth surface if you have a higher pH in the mouth. But
Hmm.
because you have the precursor cells about the compounds and you have the free floating ions, even patients who have a lower pH in their mouth are really going to benefit from this. So the engineering team has really thought through so many different angles.
Hmm. Yeah, they've looked at the low pH in the oral environment, the high pH in the oral environment. It doesn't really matter what the pH is, but
That's right.
Remin gel is going to interact with the tooth surface to heal it up either way. So yeah, it really is exciting.
Yeah.
Let's see. I think you froze up here a second. I think it's my side. Hold on one second. It'll come back.
I
There
hear you. There we go. You're back
you go.
now. Yeah.
Okay. Yeah, we'll just edit that.
Okay.
Yeah. So, and then if we go back really quick, you might think, well, is Vista Apex and our R&D team there new to all this? And they aren't. For the last 5 years, they've been developing restorative products to create
Yeah.
hydroxyapatite. And it's a little bit different mechanism, but the studies have all kind of compounded over each other, that learning. So 5 years ago, Vista Apex was out there trying to figure out, okay, how do we make restorative materials that will create hydroxyapatite and help a tooth
That's
heal?
right.
And then it
Yeah.
went to, okay, how can we do this in a tray with a gel? And it's all just kind of come together like this. And we're really excited that we have ways of doing this non-invasive care. Well, I guess it's non-restorative caries type of care. And that's the exciting part of this.
It is exciting. And as we continue to develop more data over time, we'll be able to give more predictive kinds of results that we expect. But the early data is very promising, and it's an exciting time to be part of it.
So it is. Let me ask you one thing, just to clarify everything, because we've talked so much
Yeah.
about the paratrays with the
Yeah.
paragel, and then we talked about the Remin and why we're so excited about what Remin does. But do you want to give our viewers and listeners kind of an idea of the protocol?
Oh,
If you had
sure.
that patient that has the need for paragel, and we have the patient that has the need for the Remin gel, and we're using them together, what's the protocol that you recommend?
Yeah, so you can do it sequentially. So you can use PerioProtect first with the hydrogen peroxide gel first, and it's just a super low 1.7% concentration of peroxide. That's a 10 to 15 minute application. And then if you're going to do it back to back, you just rinse your tray out, brush your teeth really quickly or rinse vigorously, and then you put the Remin gel in. That is the protocol I'm doing. So I have um, some clear demineralization on 5 and 20. I don't know what international that is, so you're gonna have to just translate that for our friends here. And so I'm in my first month where I go back and then I get an X-ray and then I go back at 3 months and then I go back at 6 months and we're trying to see if we can document. The hardest part, as you and I have talked about, is getting visual evidence because there's no standard way to determine levels of remineralization, right? We can tell
Mhm.
if it's a carrot, if it's, you've got some incipient lesions here, but often those go on a watch. They could stay there your whole life. You could be fine or not.
Mhm.
So that's the protocol I'm doing. Periprotect first. So with the hydrogen peroxide gel first. And that's just because A, I work there and I know how good it is for you. But B, I do have two crowns, and I want those crowns to last as long as possible. The first one was placed in 2009. It's going strong. I'd love it to last till, 2059, maybe. I don't know.
Yeah.
Can you get 50
Yeah.
years out of a crown? I would like to. So I want those crown margins to be really healthy. And I love the white teeth. I drink a lot of coffee. But really it's the fresh breath that when I think about the best side effects. Okay, so all of that. And then that's been part of my life for 20 years. And
Mhm.
then now I am rinsing my mouth out really well, taking my toothbrush, just doing a quick scrub of the tray. I put the Remin gel in and I wear the Remin and I go walk the dog. That's what I do. And
Mhm.
so you can do it sequentially, or you can separate them out. You can do perigel in the morning. A lot of people do this. They wear their trays while they're taking a shower or getting ready or whatever they're doing. And then you could do Remin at night.
Mhm.
That people have asked, should we take the tray out and just leave it and not brush your teeth? Uh, as long as you're brushing your teeth, this is good. We don't want to stop people from brushing their teeth, but the engineering team said you should rinse your mouth out. It's not going, you're going to have a lot of contact time with the tray. And
Mhm.
as you know, sometimes when you're doing a paste application, you'll brush it on and you'll tell patients, just leave it. Just
Mhm.
you're done. Don't eat or drink anything. Go to bed. We don't really have any other restrictions.
Yeah. Wow, that's great. So yeah, it's easy. It fits into most patients' lifestyles. And yeah, I think you're absolutely right. You're going to have healthy gums, great
Yeah,
crown margins that last 50 years. Knock.
ideally, right?
Yeah. And then yeah, just kind of the preventive aspect of using the Remin gel for the teeth. So, well,
Yeah.
from here at least you've got really white teeth. I think I smell the perfume coming through from the breath and yeah,
No, but
they're good teeth.
dental professionals, you guys take really good care of your mouths, but with periprotect, you don't even wake up with morning breath. I mean, it is y- even you, dentists and
Yeah.
hygienists out there, even you will notice the difference.
Yeah. Yeah. Because yeah, it's amazing. Not every hygienist and not every dentist flosses as well as
Yeah,
they
right.
should. So if you're not doing that, you need to get some paratrays made.
Yeah.
No, that's great. I'm not doing my paratrays right now just because I'm moving my teeth. So I got the little
Yeah.
liners, and
Yep,
soon as
yep.
my liner's done, I'm gonna have to have another set of paratrays made
There
to
you go.
catch up with y'all. No, that's great. Well, no, thank you very much. It's been great catching up with you. Again, happy birthday to
Yeah, thank you.
that 20 years and going, probably at least another 50 years. And then with this remin, and I know there'll be other developments coming out because the paired trays are the only FDA approved kind of medicinal delivery device for the use in the mouth.
Yeah.
Is that right? Yeah.
Yep, that FDA clearance came in 2005 and that's what allowed us to go to market. So it is a multi-purpose tray at this point. I mean, we've always prescribed things like fluoride in the tray, but we're in a moment where fluoride's not uh,
Yeah.
always sought after, right? And
No,
so we need
absolutely right.
other. So there are fluoride gels out there we can use, but um, it's very exciting to be thinking about some of the new technology that's coming down the pike, and so we're actively involved in developing even other options that'll be really good for patient health in the future.
Yeah.
And Dr. Mike, thanks for this opportunity. It's so nice to talk to you.
Oh no, great. Thank you. So if you like this information, hit the like button. If you want to make sure you don't miss out on the information like this or from hearing Tanya later on, again, hit subscribe. And what we're trying to do here is provide information to a like-minded group of colleagues who are always trying to provide the very best for the patients. And I think this is just one of those examples or if we can identify the need for preventative care before there's a lot of decay, before those white
Right.
spot lesions turn into big soft spots, and we can treat it now with something like the Remin gel in a delivery device like the Paratrays. I think we've got kind of the best of everything coming together so we can help our patients out. So Tanya, thank you very much for your time.
Thank you. It's so good to see you.
All right, everybody, take care, and I'll see you during the next episode. Thank you very much.